Cardiovascular disease is the leading cause of mortality worldwide and accounts for 1 in 4 of all deaths in the United States, approximately 1 death every minute. Heart failure, often referred to as congestive heart failure (CHF), occurs when the heart rate cannot generate sufficient output to meet the metabolic demands of the tissues. Heart failure may result from systolic or diastolic dysfunction. Systolic dysfunction results from inadequate myocardial contractile function, which causes reduced stroke volume and ejection fraction. Diastolic dysfunction. Diastolic dysfunction refers to an inability of the heart to adequately relax and fill, which again causes reduced stroke volume and preserved ejection fraction. When the heart can't pump blood properly, there is an increase in end diastolic ventricular volumes, increased end diastolic pressures, and elevated venous pressures. Consequences of these situations: forward failure, reduced cardiac output, which results with organ dysfunction; backward failure, increased left ventricular volume and pressure, which causes backup of blood into lungs; increased pulmonary capillary pressure results with pulmonary edema. Reduced venous circulation leads to systemic venous congestion, results with edema and progressive congestion of internal organs. CHF due to left ventricular dysfunction, characterized by forward heart failure, most commonly secondary to ischemic heart disease. Symptoms are mainly a consequence of pulmonary congestion and edema. CHF due to right ventricular dysfunction, characterized by backward heart failure, signs and symptoms are related to peripheral edema and visceral congestion. The cardiovascular system's aim is to maintain cardiac output. If stroke volume is reduced, there are some compensatory mechanisms. Compensatory mechanisms: activation of neurohumoral systems, increased adrenergic activity, increased heart rate, and augments myocardial contractility. Activation of the renin-angiotensin-aldosterone system increases salt retention and vascular tone. Myocardial structural changes. Cardiac myocytes adapt to increased workload by assembling new sarcomeres, a change that is accompanied by myocyte enlargement, which is called hypertrophy. Do not forget to like the video and subscribe to our YouTube channel.